I'm sure this news will be a relief to many women, thank God. The treatment of lipedema is finally being covered by health insurance. And what that means and how you can recognize the typical symptoms, I'll explain to you in this video. Lipedema is a condition that has long been underestimated and misunderstood, or simply confused with being overweight or with cellulite. And in Germany, millions of women suffer from it, including men. They're lucky because it's extremely rare for them, but if they are affected, this video is of course important for them as well. And that's why it's all the more important and significant to clearly explain the condition and to recognize the symptoms early on, and to avoid and clear up misunderstandings. So what exactly is lipedema? Lipedema is not simply normal overweight, as has been thought for ages. Cellulite or slight fat deposits have nothing to do with it either. Lipedema is a chronic, usually, actually, almost always painful fat distribution disorder that, as I said, almost exclusively affects women. A typical sign is a symmetrical increase of fat on the legs and sometimes also on the arms. The feet and hands remain unaffected. Unlike with classic overweight, diets alone are ineffective here, completely ineffective. Typical symptoms, by the way, are that those affected report heavy, tense legs, that they experience pressure pain, and that they bruise easily. And the feeling that the body's proportions are not right is especially distressing. While the upper body and waist appear slim, the legs and hips increase disproportionately, and this can be extremely stressful, not only physically, but also emotionally. And why is it so often overlooked? Many women hear for years that they just need to lose weight or don't go to the doctor because of it. But it's also often the case that they feel misunderstood when they do see a therapist. Doctors still often confuse lipedema with obesity, even though it is a separate condition. And the earlier the diagnosis is made, the better those affected can counteract it with targeted measures. The treatment. Finally, it is now covered by health insurance. Only recently have statutory health insurance providers started covering the costs of liposuction, that is, surgical fat removal for lipedema under certain conditions. And that is a huge, truly huge step forward, because for many women, the surgery is not just a cosmetic procedure, but also a medically necessary treatment. Okay, but there are requirements, and we're going to take a closer look at those now. There are actually body mass index limits. A body mass index over 40 currently excludes coverage of the costs, and if the body mass index is between 35 and 40, it must be proven that conservative therapies such as compression or lymphatic drainage were unsuccessful for at least 6 months. Then it continues. The stable weight situation. Before an operation, weight stability must also be documented. And then it's also about what stage the affected person is in. Currently, cost coverage mainly applies to lipedema in stage 3 and in some cases already in stage 2 if there are severe limitations. I think when you know that you have this lipedema, it really puts a huge emotional pressure and burden on you. And you absolutely have to mention this during your consultations with your doctors or when dealing with the health insurance companies, because then you have a good chance that liposuction will be covered even in stage 2. Overall, these criteria are of course also controversial because they don't always take into account how much it affects you. Women with a lower body mass index and in earlier stages suffer from pain and limitations. But at least it's an important step in the right direction. Of course, there is also additional support besides surgery, and I would like to show you that again now. Even if surgery is performed or has been performed, the disease remains chronic. And that's why it's important to do something extra for your body. Nutrition, an enzyme-rich, anti-inflammatory, balanced diet can actually improve your well-being and also be beneficial for your lipedema, especially regarding its severity. Anyone who is overweight also benefits from gentle weight loss. Now let's move on to exercise. Exercise is actually always possible and also makes sense. Especially helpful are joint-friendly endurance exercises, stretching, and also fascia rolling to keep the tissue supple and flexible. Compression and lymphatic drainage remain supportively important for many affected individuals even after surgery. And then there's also this psychological, emotional component. For me, that's not to be underestimated at all, and it's probably truly the most stressful thing for the women affected. Women with lipedema often feel misunderstood, stigmatized, or simply not taken seriously. And that's why it's so important to talk openly about it, to create understanding, and to encourage those affected. My conclusion is that lipedema is not simply a matter of body shape, but a recognized chronic disease. Finally, in many cases, health insurance companies now cover the costs of surgery. I think that's a milestone for you as those affected. But just as important are nutrition, exercise, and self-care. Every woman should know that, on the one hand, you are not alone with this condition. And there are ways to significantly alleviate the symptoms and regain more quality of life and, above all, more joy in life. I'm sure you know someone who might have a problem with this, so be sure to share this video. They will definitely thank you for it.